things, few of them Dr. Pandey highlighted. Bioimpedance spectroscopy is again our domain. Yes, lymphoscintigraphy and all, and ICG lymphography is one of the features which is done these days, and maybe during their OT itself they do it and they think of the transfer if they want to. So coming to the main topic, the treatment is complete decongestive therapy. Friends, I should tell you, yes, of course, lymphedema has no cure, but one, as we all say, prevention is better than cure. It can be prevented, as one of the slides highlighted, but very, very important, if a patient comes to you who's a cancer patient post-surgical, then definitely telling that yes, this arm should be taken care of in the form no IV, no injections, no cut, prick, burn, bite on the skin, maybe insect bite, maybe even burn while cooking. That should not be there. Definitely, if the lymph nodes are removed, and it is a precursor that yes, during air travel they should wear compression stocking. It plays a wonderful role because that latency stage can be very well taken care of. Then next is no heating. We are very, very cool on telling pain hai, hot pack laga do. No. Hyperemia is one of the things, so no hot packs. Today I thought in my talk, I have been giving these talks for various years, but still I do get patients where they say, this has been done to me, that has been done to me. So I thought this is the forum where I can put it across. No heating to them. Instead use cold packs whenever they come to you that they have back pain. Then pneumatic compression pumps, yes, they are an answer. Compression garment, it is again from latency till date, we tell them wear it. Medication, surgery, adjuvants from physiotherapy is aquatic therapy, kinesiotaping, low-level laser therapy. This has some role to play. Compression therapy, I would very categorically put it, advantages are yes, it can be done at home. It has a fast application, but a lot of disadvantages. Again, like your arteries, this also lymph also has 3 layers of cells. When you continuously keep giving compression or little more compression, rather than addressing it, you have tissue fibrosis. So you find that lymphedema is not improving. Sometimes giving high pressures, the same edema can transfer to genitals, the breast or the chest wall. So there are these disadvantages also. So like right, left and center, patient has been told, okay, buy a machine, and the patient also is not aware. The gold standard till date, the whole literature talks of it, as Dr. Pandey said, complete decongestive therapy, what physiotherapist does it, is the answer, which has majorly 4 components, which is manual drainage, compression bandaging, exercises, skin care, and of course, instructions. So, there are 2 phases. One is the initial phase or intensive phase, the other is maintenance phase. One thing I would like to clarify, that it is not that we increase the frequency of manual lymphatic drainage once the patient is getting better, no. In US, why the studies happen? Because they always give time once a week or once in 2 weeks. But in their studies, they found if it is done regularly, it is better. And I believe in our Indian clinics, we call patients regularly. So that's the right way. And more so, very, very important is, when we give manual lymphatic drainage, I put a diagram underneath. So to very categorically tell you 2 things. One is sentinel lymph node, what he spoke about, that these days we do sentinel lymph node biopsy, and then if required we remove it. Or somewhere when the disease is on other higher grade, then we do the axillary lymph node. The level of edema in axillary lymph node is way high, which is around 40% of the population may get lymphedema. But with sentinel it is only 5 to 7%. So that is one good thing. But if even the lymphedema has come up, if a therapist is well aware that which is the way it should be drained and what is the anatomy, again we'll go on the basics. Since morning we have been reiterating that it has to be your anatomy and physiology which has to be clear to really understand. So this manual lymphatic drainage, it improves the lymph vessel activity, gives the direction to flow, increases reabsorption. And of course, once if you are, it's something like you are carrying 2-3 kilo ka thela in the hand for throughout the day. How would you appreciate it? Not really. So if this is reduced, if the weight is reduced, you will definitely going to feel better. So it has less analgesic or pain-free effect. Bandaging, he has rightly put it, they are short stretch bandages. These bandages are different. They have a fair resting pressure and a good working pressure. So these bandages should be kept for 24 hours. This is very important. But again, the pressure makes all the difference. Why I'm slow in respective, I know is 1 minute for me, but it is very, very important to know that if you compress it too hard, it is going to squish your lymphatics which are right under the skin and it is going to rebound back. So we all very well know what are the qualities of exercises, but here it is important that exercises should be done with the compression bandage or the compression garment on. Second thing, yes, the garment has to be customized to patient, but my preference ever till date has remained that it should not be stitched for you. It should be seamless. There are various companies which get seamless bandages because even a stitch line adds to the pressure. So if there is a pressure gradient, definitely there is going to be some rebound. We all well know exercise improves the muscle and joint pump and venous and lymphatic return. And of course, all these exercises have to be slow, rhythmic. So I'm talking today only of those things which I really find in my practice. I request for half a minute. So we know skin care because if the skin is good, the chances of having cellulitis or infection because of skin cut, prick, puncture would reduce. These are the compression garments. As somebody was asking breast cancer related lymphedema, yes, 1 in 5 women are at risk to have breast cancer related lymphedema. So I have shown a garment which is a bra. This also is very good because most of the patients when they get their lymph node dissection, they get a pouchy stuff in the chest wall. So if these are the lymphatic compression garments, one is wrap, what you can see here, which is easy to don off. The other one is a compression sleeve and this is a compression bra. So complete decongestive therapy, volume reduction is there, restore mobility, infection prevention, improve functional status, improve cosmesis, one if your arm is thin, and of course quality of life. Surgeries, as he rightly said, but I must tell you, in my practice, I've been seeing patients coming back after anastomosis, they still require physiotherapy. But those are the patients who are very, very meticulous. And they really know how it is going to help them. Debulking procedures, I'm yet to see, I'm sorry, they do not have good results. So people do not do it. Those who do it, that is maybe just 2 pictures or few pictures you will find as images, but it is not effective at all. It gives such a bad cosmesis. If you debulk lower also, the upper is into a bad cosmesis. Very important, people should know that we should not tell them to drink less water or take less protein, but less salt. We all very well know salt will cause osmosis and more fluid retention. In my practice, we use, again, patient-reported outcomes or quality of life outcomes, which is FACT-B, which is functional assessment in cancer therapy. And DASH, we all very well know. LymphQL is also one of the things which we have worked in breast cancer patients. So many times I feel that even my therapy is not responding. So the reason can be that a good thorough assessment, is it arterial, venous or lymphatic problem? That's very, very important. Or is my treatment insufficient or there is a faulty diagnosis? These are few of my patients. This is one of the answers. This patient could never lift from 70 degrees up and thereafter, though she, because in our country we have to pay through our own pocket, so patients cannot sustain the treatment is expensive. So by the time, my theory is that I drill it into the patient. Maybe I tell them to come for 3 weeks to me, thereafter 6 months themselves and 3 weeks again. So as we were talking about in Dr. Pandey's slides, that what is the potential therapeutic target? Till date, there is no medication for it. This is what it says. Yes, of course, cytokines and chemokines, they can be markers where lymphedema can be understood. And yes, we can work on the preventive or the latency, because as soon as you capture it, you're going to help it out. What are the advances in breast cancer related lymphedema? I would just simply say it is only and only complete decongestive therapy which is still date the gold standard. Please people take it, it is only the physiotherapists or the people who have done certification in lymphedema management, they only are the best caretakers of this kind of condition. So to summarize, this is highly effective, non-invasive and remains the standard of care. Early surveillance, timely management and knowing about its incidence and progression, being aware about it can help us, and nothing like prevention. Thank you. Any questions? I might have worked for more than 1,000 patients